Hi everyone, Dr. Ruby from Pain Free and Fit and Posturesize. Today we've got some great personal training tips for you personal trainers who are dealing with seniors. We're going to add a whole new dimension to your stretching to help your senior clients help reduce injuries and increase your referrals. Hope you enjoy. So having personally trained seniors over the last 30 years and also have taught many of the personal trainers that I certify and teach techniques on dealing with their senior clients, one thing's for sure, most of the seniors you're going to be personally training have a history of injuries, chronic pain, arthritis, and the key to preventing irritation of their injuries and the key to increasing your referrals many times has to do with targeting the specificity of your exercises for them. We're going to talk about stretching today in terms of specificity. If you're teaching an exercise class or a one-on-one session with a client in personal training and you're not addressing their unique posture and mechanical faults with stretches, you're actually putting yourself behind the ball. Most clients are going to have some type of postural distortion. If you're teaching a class in terms of neck lateral flexion stretching and you're not addressing the fact that the client has one shoulder that's more rounded or one shoulder blade that's more elevated, and you're just simply doing a generic stretch throughout the class, you're going to be missing out on the retraining neurologically to help that client keep the shoulder down or the shoulder back. As you stretch, you're not going to be targeting the specific fibers of the trapezius and the levator scapula and other muscles that connect the neck to the shoulder to really stretch and improve their dynamics of their posture and their movement patterns. Many times if they suffer from neck pain, if they suffer from shoulder pain, and you're just doing a generic stretch without addressing the specifics of that client, you're actually only going to be strengthening the dysfunction, meaning that the stretch is only going to be hitting certain muscle fibers, certain angles of fascia, and it's not going to be addressing the true targeted need of that client. For seniors with injuries, for seniors with chronic pain, arthritis, personal training all comes down to trying to undo fascial restrictions, weaknesses, and biomechanical problems that many of them have been suffering with for years. So, if we had, let's say, a client with a rounded shoulder or an elevated shoulder posture on the right side more than the left, when we do that stretch away, we want to make sure within a comfortable range of motion, we accentuate the shoulder retraction or pulling it back and depression, keeping it down, so we can really not only target the specific fibers being stretched, but we can neurologically start training that client to position that body in that position, which during their personal training workouts and their daily activities is going to allow them to keep that body position in a lot more of a neutral region and avoid the mechanical stresses that are associated with their chronic pains or injuries. If we have a client that because they posturally turn to one side more habitually, more than another, and this has been happening for years, you'll see in their posture their rib cage or the center of their chest will slightly be twisted to one side more than another. You can see this when they do sit-ups, when they do crunches, when they do squats even, you'll notice or lunges, their body's going to have a tendency to twist to one side. You need to identify these corrections because if you're stretching and you're doing a rotation stretch, maybe you're teaching a senior class or a yoga chair class where you're stretching to one side. If you're not emphasizing the rotation to the opposite side, you're not going to be targeting the lats and the erector spinae and the external and internal obliques in a way that supports corrective stretching for that client. And as a result, you're going to perpetuate the normal or abnormal mechanics that are in there that's going to lead to more of their back pain, their shoulder pain, their mid-back pain. You always want to go off of what your global postural positions are, and you want to look for asymmetries. Therefore, when you're doing a stretch like that, if they have a tendency to turn to one side, that's going to be the first side they're going to stretch to, and they're not going to emphasize that side because obviously they're stronger and have more flexibility turning to the right, but you're going to end the sequence from right to left in a corrective direction of stretch, and you're going to have them spend more time there. You're going to emphasize more repetition stretching to that side. If you're not sure about what your client's unique posture and biomechanical issues are, do an analysis on them. We have such an analysis for free, a very elementary one at the posture.com website. We also have a very detailed one on our Essential Crash Course for personal trainers on injuries. If you have a senior client who you're personally training and they have a tendency to externally rotate one hip more than another, when you watch them walk on the treadmill, when you watch them sit, when you watch them squat or lunge, one foot is going to turn out more. That hip rotation has a tendency to tighten more of the lateral hamstring on that side rather than the medial or inner hamstring. If you're doing hamstring stretches, whether you're laying on your back stretching, whether you're doing passive stretches with the leg up, whether you're doing seated stretches just by extending or even leg extensions for an active stretch of the hamstrings, if you're not emphasizing internal hip rotation, meaning turning the thigh the opposite way towards neutral, then you're not targeting the outer hamstring. You're just doing a generic hamstring stretch. That's going to keep that leg out. That's going to produce more stress on the knee and the hip as well as the lower back, because that tendency on that side is compression of the lower back due to that external hip rotation mechanically. So you need to look at these postural findings. You need to emphasize them. In the case of an external rotated leg, when you do your hamstring stretches, on that side you need to stress with that personal training senior client. You need to keep your thigh pigeon-toed a little bit more. Kneecap rolled in. You're going to feel that stretch more on the outside of the back of the hamstring. That's where you need it. That's going to decrease the symptoms of many of the mechanical stresses that go into their knee arthritis, their hip arthritis. It makes all the difference. Not only will it help prevent injuries in your clients, but it's going to increase your referrals, because now you're a personal trainer who's targeting specifically an exercise routine for that individual. Even if you're teaching semi-private classes, you can go around and see these little distortions when you know how to do a good analysis and make corrections that are going to help your clients not only improve their game with personal training. Most of them have no idea of these postural abnormalities. Their PTs, their doctors aren't telling them. They're giving them drugs, they're giving them surgery, they're giving them generic PT exercises and rehab. Nobody's addressing these specific problems. You as the personal trainer are their portal of physical health. It's your job to wake them up in terms of what their unique issues are. It's not only going to be good for them, it's going to be great for your business. Hey, if you like this video on senior stretching with personal training, feel free to subscribe to our channel. We got a lot of great videos out there to help you with personal training tips. If you would like to help me share this valuable information with others, give me a thumbs up below. Questions or comments, write in. I'll do my best to answer them. And remember, we have a great essential crash course for you personal trainers if you're looking to really up your game in terms of injury prevention with your clients by really digesting the essentials of assessment, program design, and exercise modifications. I hope this video on senior specific stretching helps you with your personal training senior clients.